Welcome to this crucial conversation luncheon, Why Medicaid is Not Broken. I'm Kristen Simon, the Director of NC Policy Watch, and we're having this luncheon today with we're a project of the North Carolina Justice Center, another of our projects, the North Carolina Health Access Coalition, and you'll hear from Health Access Coalition Director Adam Searing in just a moment. A couple quick introductions. Melinda Lawrence, Executive Director of the Justice Center, is here in the front. Policy Watch staff, Clayton Hinkle, whose birthday it is, who you saw as you were checking in. So wish her happy birthday on the way out. Eugene Lee. And I think the other Policy Watch person here is our investigative reporter, Sarah Vasca, somewhere in the back. So if you have any good story ideas, tell Sarah. But we're here to talk about why Medicaid is not broken. It was interesting that State Board of Education Chair Bill Kobe yesterday was asked about why we couldn't raise teacher pay in North Carolina. We are 48th, I think, in the country in teacher pay, and he said we couldn't raise teacher pay because of Medicaid. So everything that happens to you, apparently, if you cut yourself shaving, I would blame it on Medicaid. Everybody else is blaming everything on Medicaid. We're here to tell you today why that is wrong-headed and why Medicaid is actually working. We have a great panel, and to introduce them and tell you a little bit more about the luncheon is Rob Schofield at NC Policy Watch.
Thanks, Chris. And well, as Chris says, hardly a day goes by of late when Governor McCrory or House Speaker Tillis or Senate President Pro Tem Berger or some other conservative leader doesn't allege that Medicaid, our health care program for poor people, is broken. In speech after speech, event after event, media appearance after media appearance, state leaders repeat the same mantra. To rein in the supposedly out-of-control spending, Medicaid must be fundamentally altered so that it is a program based on quote, choice, quote, efficiency, and quote, competition. And Chris just told you that yesterday the chair of the State Board of Education alleged that the reason we don't have enough money to pay teachers in the state is because of Medicaid. And while this is a superficially appealing argument, there's only one big problem with it, and that it is demonstrably false. But the truth of the matter is that despite its many imperfections, North Carolina's Medicaid program remains a model for the nation, and a program that state leaders should be strengthening and expanding rather than shrinking and trying to privatize. So here today to help us understand this critical issue that stands at the heart, really, of the current policy debate in North Carolina are two extraordinarily talented and knowledgeable men. Our featured speaker today, of course, is Ron Pollack. Ron is the founding executive director of Families USA, the national organization for healthcare consumers. Their mission is to achieve high-quality, affordable health coverage for everyone in the country. And through the years, Families USA's numerous reports and analyses on such matters as health coverage for the uninsured and underinsured, Medicaid, Medicare, prescription drug issues, long-term care, and others have been repeatedly cited in congressional hearings, state legislatures, by the media, and of course by organizations like us around the country. And in addition to leading Families USA, Ron is the founding board chairman of Enroll America, an organization composed of a very diverse stakeholders working to secure optimal enrollment of uninsured people through effective implementation of the Affordable Care Act. And Ron has a distinguished career in public service and in advocacy in the progressive world. In 1997, he was appointed by President Clinton as the sole consumer representative on the Presidential Advisory Commission on Consumer Protection and Quality in the healthcare industry. He helped prepare a patient's Bill of Rights that has been enacted by many state legislatures. And prior to his current position at Families USA, Ron was the dean of the Antioch School of Law, and he also was the founding executive director of the Food Research and Action Center, FRAC, a leading national organization focused on eliminating hunger in the United States. Ron received his law degree from New York University, where he was the Arthur Garfield Hayes Civil Liberties Fellow. But he'll be preceded to the podium today by my friend and colleague, Adam Searing. As I'm sure you all know, Adam is the longtime director of the North Carolina Health Access Coalition, a special project of the Justice Center, just like Policy Watch. And he's obviously, for many years, been North Carolina's most visible spokesperson for progressive healthcare reform. And over the past decade and a half, really, he has helped envision and secure more improvements to our healthcare system than I have time to list. He is a relentless advocate, a much in-demand speaker, a prolific writer, a gifted videographer, and he received both his public health and law degrees from UNC Chapel Hill. So Adam's going to come up and give us a very brief introduction. I hope you'll all enjoy that, and then we'll get to hear from Ron Pollack. So please welcome Adam Searing.
All right. Thank you very much, Rob. I will be very brief. My goal is to be under 10 minutes, hopefully under 8 minutes, because I want to hear from Ron too. We've been having a great morning talking to a bunch of media about the realities of North Carolina's Medicaid program, which is a success story and is not broken, as some politicians seem to refer to it. So, when I was thinking about how to do this introduction, I was thinking about, why is our Governor McCrory, keeps saying, and others in the legislature keep saying Medicaid is broken. They keep, it's again and again and again, Medicaid is broken, Medicaid is broken. And it's just hard to square with, for instance, just last month, U.S. Senator Richard Burr, who is no global shrinking violet, our very conservative senator, gave our North Carolina Medicaid program a national award from the Healthcare Leadership Council, praising us for containing costs and improving quality of care. And so I didn't really understand that, but I'll show you just a very quick video. I thought, where could the governor be getting this idea that Medicaid is broken? Does it have anything to do with his refusal to expand Medicaid? So I went and I looked at what some of the other governors who also refused to expand Medicaid around the country are saying. And I pulled out some of the videos. So let's take a quick look. It's not even a minute.
Several reasons. One is our current Medicaid system in North Carolina is broken. The system of delivery.
Those new innovative ways are what Republican governors are looking at across the country before we expand a broken system.
Instead of expanding a broken program, we will continue working together to implement real health solutions for South Carolina.
Well, it's a broken system. It's a totally broken system right now, and it is not working well. Not only in Alabama, it's not working well anywhere.
The bottom line here is that Medicaid is a failed program.
What we're saying is put 16, 17 million more people in Medicaid, a program that's already broken, that's already antiquated, doesn't make a lot of sense.
All right. So now we know that this is some sort of talking point that is that if you didn't expand Medicaid, that you want to say that Medicaid is broken. That'll be the way to go ahead and take the heat off. Take the heat off from saying that you don't want to make sure that 500,000 North Carolinians in the state get health care. But what's the reality of North Carolina Medicaid? There's a lot of talk about we're overrunning the budget. Nobody's saying we're spending money, that children are getting health care they don't deserve. That's the majority of people who get health care on Medicaid. No one's saying that. They're saying, no, we overran the budget. So I think at the bottom line, what's happening is what former DHHS Secretary Lanier Kanzler, another Republican, for our former DHHS Secretary said, is the way he put it is, if you have a mortgage on your house and that mortgage is $2,000, and if you budget $1,800 a month for that mortgage every month, then every single month you're going to be over budget. Now that's not because you are spending more on your mortgage than you should, it's because you weren't realistic about the cost of the mortgage in the first place. And then when you look at the actual cost of Medicaid in these 5, and I promise there are only 5 charts that I put up, then you're going to see that we're actually in North Carolina really a success story rather than a broken system. So the first one is, I just went, and anybody can do this. You don't have to be a rocket scientist, okay? You really don't. You can go to the Kaiser Family Foundation website. They're the most respected resource on gathering health data from across the country. It's called statehealthfacts.org. And I just went and said, okay, let's take a look at the growth in the average annual growth in Medicaid in North Carolina, and I'll compare that to the rest of the country, and we'll start way over here at 1990, and we'll end up here with the very latest data in 2010. And this blue line shows that for the last 20 years, almost every year, we've seen a substantial decrease in how much our Medicaid program is growing. And in fact, right here, we are the lowest growth in our Medicaid program. We're the lowest annual growth in our Medicaid program in the entire country right now. In the entire country, we're doing so well. And this is the line for the average for all the United States. And it went down for a while in tandem with us, but now it's going back up. You know, there are lots of causes that go into this, recessions and stuff like that. We are doing really, really well. So number one, just look at the numbers. Number two, you know, people say, oh, we're paying so much to all those doctors and hospitals. We're paying so much in North Carolina Medicaid. It's breaking the budget. Well, you know what? I went and actually looked at what we've done, again, Kaiser Family Foundation, through Medicaid fees just over the last 4 years. That's actually, the data ends in 2012. And except for primary care, which we haven't really increased very much, we're actually decreasing the fees that we're paying to our providers. So not only are we keeping growth low, we're not overpaying people, we're actually cranking down on what we're paying to our providers, and we're asking them to deliver really, really good care. So that's the second part. Now we're on 3. We've only got 2 more. So this one is interesting. I was actually I teach occasionally, and I was looking at this chart that has this is all the cost of having a baby in the hospital in all these different countries in the world and in the United States. Now, most people who've been listening with even half an ear to the healthcare debate over the last 4 years realize that, in the average wealthy country, United Kingdom, Netherlands, Switzerland, France, even Australia, they pay about half of what we pay. So the average you can't see this, it's about $9,000 is what you've got to pay to have a baby, just normal delivery in the United States, just in the hospital, so we're going to include prenatal care. Everywhere else, it's like $2,000, $3,000, $4,000, okay? So, that's a whole nother conversation in itself, but we're paying a lot. And I thought, to talk about, when people talk about Medicaid's out of control, I thought, what do we pay for that same service in our Medicaid program in North Carolina? And you know what? We pay $3,000, $3,347. So the average cost in the United States is about $9,000 for normal delivery. We're paying about a third of that to our hospital in our Medicaid program. And if you can't tell me that we're running a program that is wasting a lot of money if we are paying that much for delivery and much lower than the average. Now, I've talked a lot about costs. What about quality? Well, there are lots of measures of quality, and I want to really hear from Ron, but I just wanted to take one. And I'm not going to say that we're the best, the best in the country, because we're not. But this is a chart that says infant mortality rates. How much have they declined in the last few years? And the states that are in the deepest green right there, so these 5 states, of which North Carolina is one, in the last 5 years have had a decline in their infant mortality rate of 20% or more. Okay? That is huge. Infant mortality is one of the main indicators of how well our health system is doing. Medicaid, one of the reasons that we have expanded our Medicaid program, for instance, to pregnant women, an expansion which the North Carolina Senate has said they would like to rescind and kick pregnant women off the Medicaid program. One of the reasons is that one of the results is that we have seen a significant decline in infant mortality rates. Is it where we want to be? No, it needs to be much better than that because we've started so low. But our program is delivering really high quality care. So what have we got from all this? We've got lower costs, we've got increases in healthcare quality, and what did we get from Governor Pat McCrory and the legislature? Well, we got complaints, and here's again DHH Secretary Lanier Chancellor saying, this is a letter that he wrote before the last budget cycle to the leadership of the General Assembly, to Tom Tillis and Phil Berger, and he said, look, you guys, the aggressive budget cuts mandated by your budget are unreasonable and unattainable. And this was well before all the carping about how awful Medicaid is. He was giving them, they got in writing the notice that they were not going to meet that budget. So what did we get for all this? The legislature was on notice. We know that we're reducing costs in our Medicaid program. We're delivering much better care. Well, we got this. We got Governor Pat McCrory and some of the other legislators signing the bill that rejected the $1 billion in federal money for expanding our Medicaid program and the state partnership exchange. Now, you don't get that unless you ignore the evidence on Medicaid, and I am really tired of people ignoring the evidence on Medicaid, and that's why I'm so happy that my friend Ron Pollack, who I've known for over 15 years, who is one of the best, who's the best healthcare advocate in the country, who worked his entire career to make sure that people have decent, affordable health care, who has done all the stuff that Rob has said he's done and more. And we would not have an Affordable Care Act without Ron's work. And it doesn't mean just in Washington, but around the states. And it has meant a lot to me and a lot to many, many people in our state. So it is so much a pleasure to have him here, and I'm so eager to hear from him and to hear what he has to say. So Ron, come on up.
So Adam was saying I've worked my entire career, not yet. So am I supposed to start by saying Medicaid is broken, Medicaid is broken, Medicaid is broken? I have to say, when I saw the redundancy, it actually reminded me of something that happened to me many years ago. I was giving a speech, and I was looking around the room as I am now to see whether anyone was paying attention to me. And on this wonderful occasion, I was fixated on a woman seated. It was a classroom seating arrangement in the fourth row, and she was taking copious notes of everything I was saying. I thought, this is great. I'm actually reaching somebody. And I could feel the adrenaline coursing through my body. And I thought I gave a pretty good speech. At the end of the speech, however, a number of people came up, but she was the very first one, and she had this warm, wonderful smile on her face, and she said, "Mr. Pollack, I want to thank you. You were absolutely superfluous." You do, I thanked her. But she went on, she said, "Now, Mr. Pollack, I want to know, do you intend to do any writing on this subject?" So I thought a moment, probably scratched my head, and in the spirit of her previous comment, I said, yes, I intend to do writing on this subject, and I hope to have it published posthumously. And she looked at me with this warm, wonderful grin. She said, "You know, that's just wonderful, Mr. Pollack, because it just couldn't happen too soon." So I'm not going to be superfluous. The Medicaid is not broken. And I'm really delighted to be here in some guise other than posthumously. So I want to talk a little bit about where we are as a nation and how this fits with North Carolina. We have right now, according to the Census Bureau, 49 million people who are uninsured. That's an extraordinary number. And I don't think any of us in this room can sort of grab a hold of what does it mean to have 49 million people uninsured. And the only way I can think of trying to explain it, and even that is inadequate, is that the number 49 million is actually larger than the aggregate population of 24 states plus the District of Columbia. That's extraordinary, that we have almost as many people uninsured in the country as the combined population of half the states in the country. Obviously, I'm not talking about California and New York, but that's rather significant. But what is even more significant is that the number that you typically hear about how many people are uninsured, which comes from the Census Bureau each year, we'll hear it again in September, is actually, they ask a question, in effect, were you uninsured throughout the calendar year? And most analysts actually think that's not exactly what these numbers portray. Most analysts believe that the numbers actually portray how many people were uninsured at a point in time, such as at the time the survey was undertaken. And assuming that the overwhelming majority of analysts are right about this, I have no reason to believe otherwise, it still understates in many ways how many people have difficulties gaining access to coverage, because as you know, income varies very significantly from one month to another, or certainly 1 year to another. And before the Affordable Care Act was passed, we at Families USA kept on doing analyses, also based on Census Bureau data, that tried to calculate how many people were uninsured at some point over the previous 2 years. And the last time we did this, and I have no reason to believe the numbers are much different today, is that there were a little over 85 million people who were uninsured at some point in the previous 24 months. Now think about that. Of course, that people who are 65 and older participate in the Medicare program. So typically they would not be counted in that 85 million people. But this constitutes almost 1 out of every 3 Americans under 65 years of age. And so the Affordable Care Act was designed to make some significant improvements. And I'm not going to say to you that the Affordable Care Act is a perfect piece of legislation, but it's an extraordinary and certainly historic piece of legislation that is going to move our nation, I think, in a very significant way to a better place. So I'm going to focus on coverage mainly, although we could have, I think, a very good, thoughtful conversation about what this means in terms of quality of care and cost of care. But the Affordable Care Act essentially has 2 tools that are the predominant ways that we are going to expand coverage throughout the United States. And I'm sorry to say that the governor and the state legislature has rejected one of those tools. The second tool the governor couldn't reject, and that is expanding the Medicaid program. So where are we today with respect to the Medicaid program? You know, one of the things, as a former someone involved in the law, I took interest that, you know, the Medicaid program actually has its roots, believe it or not, in the 16th century Elizabethan poor laws of England. Now, what do I mean by that? Well, the 16th century Elizabethan poor laws said, if you want to get social welfare in England, it is not satisfactory that you just be poor. You have to be poor and you have to fit a deserving category. Well, deserving categories in the eyes of the beholder. In 1935, we as a nation here in the United States picked up that system that has its founding in the Elizabethan poor laws when we passed the Social Security Act in 1935, and we created our social welfare system. And we created 4 categories of people who are deserving of help in our social welfare system. In no particular order, it was aid to the permanently and totally disabled. It was old age assistance. It was aid to the blind. And then it was aid for some kids, not all kids, not even all poor kids. It was aid to dependent children, children who were missing a parent from the household. And in 1965, when the Medicaid statute was enacted, the pathway onto Medicaid was by virtue of being a participant in these social welfare programs. And that's how we really closed the circle and made Medicare really truly have its roots in the Elizabethan poor laws. Now, since 1965, when Medicaid and Medicare were enacted, we tried to attenuate somewhat the relationship between receipt of social welfare and Medicaid. But you still see the remnants of it, and you see it big time in the state of North Carolina. And that is, take 3 different groups, and we treat them totally differently from one another. One group is children, another group are the parents of those children, and the third group are other adults who don't have children, dependent children in their household. And we as a nation treat those 3 groups totally differently through our Medicaid programs. So talking about the nation as a whole, children, by and large, in states across the country, due to the confluence of Medicaid and the Children's Health Insurance Program, CHIP, kids are eligible for public coverage if their family incomes are below 200% of poverty. And some states go higher than that. New York goes to 400%. New Jersey goes to 350%. But essentially, it's 200% of poverty. So for a family of 4, the kids are eligible at 200% of poverty at approximately $47,000 in annual income. We treat the parents of those kids totally differently around the country, and we certainly do that in North Carolina. In the states across the country, the median income eligibility standard among the 50 states is not 200% of poverty, it's not 100% of poverty, it's 63% of poverty. And so parents are ineligible when their kids are eligible, even though they may have less than 1/3 of the income that is the standard for children. Now here in North Carolina, then the third group are other adults, singles, childless couples, adults who don't have dependent children. And in 43 states throughout the United States, one is ineligible for Medicaid irrespective of what your income is. And I'm not saying this rhetorically, I'm saying this literally. You literally can be penniless and you're ineligible for Medicaid if you're an adult and you don't have dependent children. So what is the application of that here in North Carolina? In North Carolina, parents are ineligible for Medicaid if they're, for a 3-person family, if their incomes exceed, I'm rounding off, about $9,600, $9,600 annually. For a family of 4, again, I'm rounding here, it's about $11,600. And this is when, as Adam's slide shows, you know, the average cost of health coverage for a family, $16,000, $15,000. And yet, we as a nation don't provide a safety net for folks. To the extent you call Medicaid a safety net, for these populations, that safety net is far more whole than it is wet. So the Affordable Care Act was designed to change that. And that's the genius of the Affordable Care Act. And again, there are flaws in the Affordable Care Act, but this is an extraordinary improvement. And so the Affordable Care Act says we're going to create a floor under which nobody can fall, irrespective of their family circumstances, irrespective if you're a parent or you're a non-parental adult, at 138% of the federal poverty level. So roughly, for a family of 4, $32,500 in annual income. However, last June, the Supreme Court modified what the Affordable Care Act was trying to do. And it modified it only in the area of Medicaid. And in effect, what it said, without going into the details of the litigation, is it took the expansion of Medicaid, which was supposed to be a mandate, a guarantee, that people below 138% of poverty, that everyone across the nation would be guaranteed coverage through the Medicaid program. It said it would be a state option. And so it's really changed what we need to do as advocates to try to make sure that the people who need help the most actually receive it. Well, in North Carolina, according to the North Carolina Institute of Medicine, if the state opted into the Medicaid expansion, about 500,000 people who are currently uninsured would gain health care coverage. But as you know, the governor has chosen not to opt into the Medicaid expansion. Now, it's really important to understand that other facets of the Affordable Care Act relative to Medicaid were not changed. Most importantly, the Affordable Care Act provides really an extraordinary, generous amount of help to any state that expands the Medicaid program. Come January 1, 2014, any state that opts into the Medicaid program, and for the remainder of that year and the following year and the year after that, 2014, 15, and 16, the federal government is going to pay 100% of the costs of the Medicaid expansion. Moreover, for states like North Carolina, but other states across the country, not only is it receiving an extraordinary amount of money, and approximately the amount of money that would be provided to the state on an annual basis is approximately $2 billion from the federal government. This number that also comes from the North Carolina Institute of Medicine is a 2016 number, and the reason I'm sure the Institute took this number, just like some of us who've done other studies, is that when you start a program, as you do in January 2014, it's not a mature program right away. A lot of people still don't know about it. A lot of people don't get signed up. So it takes a little bit of time before it becomes a mature program. But 2016 is a reasonable period, the third year of implementation. So the Institute says that the federal funding that would come to the state if the governor and the state legislature opted into the Medicaid expansion is $2 billion. But it does more than that. And what it does is that it's actually going to save the states some money that it's currently spending, because states across the country provide some help for folks who are uninsured, particularly if an uninsured person goes to a public hospital. They're probably going to get help at in the emergency room. But if they can't pay for it, the hospital's going to not be able to stay in existence if it just provides uncompensated care. And so states like North Carolina provide some funding, particularly for public hospitals, to pick this up. And obviously, if you get those folks insured, the state wouldn't have that expenditure, and it would be saving money. Moreover, if we expanded the Medicaid program, it would add jobs in the state. The Institute estimates that the number of jobs that would be increased in the state of North Carolina is over 25,000 jobs. That's pretty significant. And that would increase significant economic activity. And as a result, the state would be getting more revenues in terms of taxes without increasing tax rates. It's something most folks in government want. So it is for that reason that I would suggest to you that Governor McCrory and the state legislature are committing fiscal malpractice by turning down the state Medicaid expansion. So I want to talk a little bit about why Medicaid is so important. But I want to be clear. There are 8 Republican governors who have done something different than Governor McCrory. And some of these are household names, and certainly you know these are names of governors who consider themselves and are reputed to be very conservative. Governor Brewer of Arizona, Governor Kasich of Ohio, Governor Christie of New Jersey, Governor Scott of Florida, Governor Martinez of New Mexico, Governor Snyder of Michigan, Governor Dalrymple of North Dakota, Governor Sandoval of Nevada. Every one of those governors, Republican, conservative governors, governors who raced to the courthouse door to challenge the constitutionality of the Affordable Care Act, are saying, we are prepared to implement the Medicaid expansion. So They know that it is good for their states. But apparently Governor Dalrymple, I'm sorry, Governor Dalrymple, that's North Dakota. Governor McCrory obviously thinks otherwise. Now it's interesting, recently we released a study together with the Joint Center for Economic and Political Studies. It's the African American think tank based in Washington. And a survey was undertaken of the 5 deepest southern states. Did not include North Carolina, but it did include Louisiana, Mississippi, Alabama, Georgia, and South Carolina, to try to find out what do the people in those 5 states, probably the most conservative part of the country, think about expanding the Medicaid program. And by a very significant majority, people in those states, in each of the 5 states and in the aggregate, said it made sense to implement the Medicaid program. And then you broke it down by demographics, by race, and other factors, including how people self-styled themselves in terms of their political orientation. Among African Americans, it was a very substantial majority. But even among whites, there was a clear majority in those 5 states that said the Medicaid expansion should go forward. Among those who self-styled themselves as liberals or moderates, it was overwhelmingly in support of the Medicaid expansion. For those who self-styled themselves as conservatives, it was almost even, 46 to 48%. So I would suggest that this does not really square with what the public wants. Now, I'm going to divert for a moment. You know, our nation is somewhat different than other countries in terms of how we treat health care. And in 1993, 1994, the last time we had an effort to try to get health reform in our country, when Bill Clinton was president and Hillary Clinton was pushing hard for health reform, we tried to help make the case of why this was important. And as part of that, we started preparing different studies about what different countries do about their health system. And on this particular occasion that I'm thinking about, we had just published a book called Looking North for Health. And it was a book about the Canadian healthcare system. And it wasn't because we were pushing necessarily a single payer system, but we thought we could learn from different countries. And so when we released this book, we had a forum in the Capitol about the Canadian healthcare system, and the Minister of Health was our luncheon speaker. And what was significant was Canada has 3 political parties, and this minister was from the most conservative of the 3 political parties. I introduced him and I sat back and listened to his speech. And I was flabbergasted. It was the most liberal, progressive speech I had ever heard in Washington, D.C. about America's healthcare system. So after his speech, I went over to the former premier of Saskatchewan, which is where the Canadian system developed. And the premier was from the most liberal of the 3 parties. And I said, I don't understand this. This was the most liberal, progressive speech I've ever heard about health care in Washington. What in the world could be the difference between your 3 political parties? Your conservative Minister of Health, Ted Kennedy, would have blushed had he heard that speech. So he said, I'll tell you what the differences are between our 3 political parties. He said the most conservative of the 3 parties, that goes by the oxymoronic title, the Progressive Conservatives. The Progressive Conservatives, they believe in health care from cradle to grave. It's not too bad. The middle party, which is called the Liberal Party, they believe in health care from basket to casket. You're going to have to pardon me on this one. So the premier lit up and he said, but we of the NDP, we believe in health care from erection to resurrection. So I was going to go through the litany, and I'm going to spare you about why Medicaid is so important. You know, I'm going to rely on Kaiser Family Foundation, which tells us that when you compare those on Medicaid with those who are uninsured, in terms of those who don't have a usual source of care, it's 2.5 times greater for those who are uninsured versus those who get Medicaid. In terms of those who had an unmet medical need, 4 times greater the uninsured than those in Medicaid. If you compare the out-of-pocket spending for people who are uninsured versus those in Medicaid, it's extraordinarily different. But there's so many other things. If you're in Medicaid, you get preventive care services. The very significant study that's continuing in Oregon shows that the difference between those on Medicaid and those who are uninsured, 30% difference in the rate of depression. In terms of access to care, actually it is not much different between employer-sponsored insurance and participating in Medicaid. So there really are some benefits in participating in Medicaid. I want to divert for a moment because there's a second way that the Affordable Care Act is designed to make sure that we extend coverage for people who don't have it. And here, Governor McCrory cannot reject this. And that is that those people who have income between the poverty level and 400% of poverty. Let me define what 400% of poverty is. 400% of poverty for a family of 4 is $94,200 in annual income. For a person living alone, it's about $46,000. For those between poverty and 400% of poverty, what the Affordable Care Act does is it enables people to get coverage through private health plans, and if they have incomes below 400% of poverty, they will get very significant tax credit premium subsidies to help them pay for the premium. Now, what do I mean by this? It's actually it's a subsidy. It works differently than many other tax credits. The way it works is that if you are eligible and you enroll, then based on your income, a determination will be made about how large a subsidy you will receive. And unlike tax credits where you lay some money out and then the following April 15th when you file your tax returns, you then try and recoup that through the tax credit. Here it works differently. You're not laying out any of this money. What happens is you'll have signed up for an insurance plan that you have selected, and the IRS will pay that plan the size of the tax credit on a monthly basis. So as your premiums fall due, the IRS will be paying that health plan a substantial portion of your premiums, which means if the premiums were, I'm giving you a hypothetical number, if the premiums were $15,000 for family coverage, and you were eligible for a tax credit subsidy of $12,000, the remaining portion, $3,000, is what you would pay over the course of the year on a monthly basis as premiums fall through. That's a whole lot different than paying $15,000 out of your own pocket. So you're not laying this out, and you are getting direct help, a direct subsidy that makes your insurance a whole lot more affordable. Now, in North Carolina, we released a report not too long ago that shows that there are approximately 869,000 people who will be eligible for these tax credit premium subsidies. In Wake County, it's almost 70,000 people. It's about 69,800 people. In Durham County, it's a little over 23,000 people. So this is pretty significant. And mind you, the overwhelming majority of people eligible for the tax credit premium subsidies are in working families. The percentage in North Carolina, 89% of this approximate 869,000 people eligible for the tax credit premium subsidies are in working families where there is at least one breadwinner who is working. And it's spread on other demographic factors. 64% of the folks eligible are white, 19% are African American, 11.5% are Hispanics. This is significant, and the reason I wanted to mention this to you, I really wanted to talk about what I think is the foolishness of the governor and the state legislature rejecting the Medicaid expansion, and then the further foolishness of taking what Adam has described as a good current Medicaid program in terms of quality of care and keeping costs down and changing that system because allegedly Medicaid is broken. But the reason I diverted and wanted to talk about the tax credit premium subsidies is because this is something all of you can play a significant role in. The enrollment period begins on October 1. We're almost 100 days from the enrollment period. And the first enrollment period is unusual because it's much longer than subsequent enrollment periods are going to be. This first enrollment period starts on October 1 of this year and ends on March 31 of 2014. In future years, the enrollment period will essentially start on October 15th and end on December 7th. So it's not even 2 months. And obviously, people who are uninsured want to get coverage as quickly as possible. And so I emphasize that to all of you because you may know people who can benefit from these tax credit premium subsidies. They live in your midst. They may be part of your family. It may be even that you may be eligible for these tax credit premium subsidies. But it's not automatic that people are going to get it. You have to sign up for it. You got to get enrolled. And so we've got to make sure that people learn about this. And here's a really important thing to understand. As Adam said, I started a group called Enroll America. I guess, Rob, you said it. So Enroll America is designed to make sure that we get as many people covered who are eligible for new coverage. And one of the things Enroll America did was they took a national survey and then they did focus groups. And what we found in the national survey is of the folks who are uninsured, who are eligible for the tax credit premium subsidies, more than 3 out of 4, 78% were unaware of what they are eligible for, newly eligible for. And in those states where the Medicaid program is going to be expanded, unfortunately that does not include North Carolina, 83% of the people eligible for the Medicaid expansion are unaware of it. And so all of us, literally all of us, have got a job to do. We've got to make sure that people understand how things are going to change, how there are new opportunities, but if they don't get enrolled, then all these potential benefits will be unavailable. So I really want to emphasize that. I guess the last thing I want to say is that there's very little I can do to amplify on what Adam's already told you about existing Medicaid program. I can say that there are numerous very distinguished organizations that don't have an axe to grind politically or in any other way. Groups like the Center for the Study of Health System Change, the Kaiser Family Foundation, Commonwealth Fund, Mathematica, have extolled the virtues of the state's Medicaid program. Not the eligibility standards, obviously, but the way the program is working. And creating what we often call medical home type models that have case managers and that try to make sure that people at risk really know about different opportunities of care and get their care coordinated in a fashion so that people who have the greatest need for health care often have multiple health problems, chronic health conditions, and they're seeing a number of different specialists. and nobody's coordinating the care. You know, each specialist is doing the best he or she can in terms of the particular problem, but there's no coordination. What one specialist is doing in terms of medicine may be somewhat harmful for another condition. So North Carolina is doing something really significant in terms of coordinating care. And it's one of the few states that the National Committee for Quality Assurance says is on target on most of the key indicators of quality of care. And so when the governor or the state legislature want to scapegoat the Medicaid program, don't let them change what is good. It's bad enough that they're not accepting something that would make it better. But don't let them scapegoat something that North Carolina is doing and is doing well. And many other states are looking to North Carolina to potentially emulate, and some are beginning to emulate what North Carolina has done. So let me leave you with one story. I'm sure Adam have heard this story before. How many of you remember the name Claude Pepper? A number of you. So Claude Pepper was not just a champion of people of a certain age, but he also was a champion for universal health coverage. As the story goes, Claude Pepper passed away, and he ascended to heaven, and he was met at the pearly gates by St. Peter. And St. Peter said to Pepper, "Senator, you've lived an extraordinary life. How can I make your life here in heaven a good one?" Well, Pepper was pretty brusque and went right to the point. He said, "I want to talk to the Lord, and I want to find out, are we going to get universal health coverage in the United States?" St. Peter said, "You know, that's rather an unusual request. We've never gotten that request before. But you've lived an exemplary life. So let me see whether the Lord is willing to, I'll talk to the Lord, and we'll see whether she's willing to honor your request." So you come back here the next day, and I'll tell you what the Lord has said. So the next day, Pepper came back, and St. Peter came back. And St. Peter said, "I spoke to the Lord, and in light of the wonderful life you've led, she's willing to entertain your request. You just wait here." And the Lord came, and the Lord said, "Senator, we're delighted that you're here, but I heard from St. Peter that you have an unusual request." And Pepper went right at it and said, "Yes, I want to find out, are we going to get universal health coverage in the United States?" And the Lord looked at Pepper and said, "Well, Senator, I've got some good news for you and some bad news for you. The good news is we will get universal health coverage in the United States. The bad news is it won't happen in my lifetime." Well, we can get real close to universal coverage. Let's turn North Carolina governor around in terms of ultimately seeing the light about the Medicaid expansion. And in the meanwhile, let's make sure that everyone eligible for these tax credit premium subsidies get them, because it will mean a lot of people who are currently uninsured can get health coverage. So thanks so much.
We do have time for a couple of questions, if that's okay with you, Ron. I want to ask the first question because I think I can anticipate what some folks on the other side will say and frequently do, which is that those charts that Adam was showing talked about rate of increase. That even though we were doing better than most states, that that it was continuing to rise in cost. What is the response to that? I mean, it is true, obviously, that the cost of even Medicaid continues to rise, even in a state like North Carolina, where we're doing better than most. What's your take on that? Is it just healthcare in general?
Well, healthcare costs are increasing much faster than they should. And part of what the Affordable Care Act does, we could have a totally different conversation about this. The Affordable Care Act not only is designed to expand coverage for those people who don't have it, but it's to make some really starts on trying to ensure that America's healthcare system pays more for quality rather than quantity of services. And in the process, improves quality of care. Now, we have had a deceleration of healthcare costs over the last several years. And policy analysts and healthcare analysts are not yet certain about all the reasons for that. Some reason, obviously, there's some factor that relates to the economy, that when the economy went down and more people were unemployed, that had a negative effect in people seeking care that they might have sought under different circumstances. But it really does seem like some of the system changes that are embodied in the Affordable Care Act are making some differences. And most of them are fairly experimental in nature. And one of the things that we all will need to look at and participate in the future, we've not ended legislation on health care reform. And nobody, I think, even the strongest advocates for the Affordable Care Act is going to say it's perfect. We're going to build on it. But one of the things we're going to build on is to try to improve on the confluence of strengthening quality while decelerating costs. And some of the experiments that are catalyzed by the Affordable Care Act hopefully will turn out to be rather successful, and we will try to have them expanded on a more systematic way. And it is my hope and my belief that as a result, we're going to get better quality of care, and the cost increases that have occurred over the last decades will decelerate.
Thanks. Do we have in the back, sir?
Hey, I'm Don Taylor from Duke University. Thanks for coming and enjoyed it. Do you have any thoughts about the other lawsuit, so to speak, the federal case from Oklahoma, I think it is, that essentially is saying in states that are going to have federal exchanges like North Carolina, they've asked the courts to bar the flow of premium subsidies. Do you take that seriously? Because obviously if that happened, North Carolina would be totally out of business for the first year of the Affordable Care Act.
Well, I initially didn't take the NFIB case seriously, and that was a mistake, obviously. It's not, by the way, just in Oklahoma. There's litigation that's been filed in the District of Columbia, federal district court in the last few weeks. Same thing, just so you understand exactly what this question is. The plaintiffs in these two cases are saying that these tax credit premium subsidies that I talked about before that are very substantial, very significant thousands of dollars on a sliding scale, better for those people with lower incomes to get more subsidies. The plaintiffs are saying that under the Affordable Care Act, the statute is written in such a way that by the face of the language, it appears that these tax credit premium subsidies are only supposed to be made available in the states that are running their own marketplaces, exchanges, and do not apply to the so-called federally facilitated exchanges like North Carolina, where the federal government is going to run the marketplace. If that litigation were to win, that's a big deal, frankly. Because it would mean that, I said there were two different prongs to getting expanded coverage. One on a state option, the other is going to happen all across the country. And if that litigation wins, it means that states like North Carolina, about 33 states, are not going to be people in those states are not going to get the tax credit premium subsidies. I don't know whether you're a lawyer or
I'm not a lawyer, so.
Good.
Got that going for us.
I got to say, when I was a law school dean, I had a sign behind my desk. It was a quotation from Chico Marx. It said, "If you have a problem, get a lawyer. Then you got a bigger problem, but at least you got a lawyer." So I apologize to the lawyers in the room. But there's one key question that has to be decided before they get to the merits of this, and that is whether the plaintiffs in those cases have so-called standing. Do they have a right to bring this litigation? It even goes before the merits of the case. And I think there's a strong argument to be made that in both Oklahoma and the District of Columbia, those folks do not have standing to sue. If, however, the courts rule that they do have standing to sue, then they'll get to the merits. And I have to tell you that the statute is inartfully written. That's the only way I can say it. And it's inartfully written because of the happenstance of the way the Affordable Care Act passed. I don't know, this is probably more than you want to even hear about. There literally wasn't a single Republican who voted for the Affordable Care Act. And moreover, Republicans in the Senate wanted to filibuster the legislation. And so in order to defeat the filibuster, you needed at least 60 votes. And the Democrats had in their caucus 60 votes, if you include a couple of members who were not affiliated but caucused with the Democrats, people like Joe Lieberman. And so when the Senate first considered the legislation, they had 60 votes. And the legislation passed the Senate. Before the bill came back to the House, Senator Kennedy passed away. And his replacement was from a different political party. And so the Democrats no longer had 60 votes, they had 59 votes. So what do? Because what would happen is when you go to conference committee, then it goes back to the two houses, and you can filibuster all over again unless you break the filibuster. And the Democrats had no capacity to break the filibuster with only 59 votes. So what was decided was that the House would take the Senate bill, even though the House didn't like the Senate bill all that much, because they had their own version, and they passed the Senate bill so that that bill would not have to go back to the Senate for passage. And that was part of the legislation. And then to ameliorate the concerns that at that point Speaker Nancy Pelosi had about the legislation, she wanted some fixing of the legislation to improve it from her perspective so it was closer to what the House did. So there's an arcane procedure that goes by the misnomer reconciliation. Don't ask me to really explain it, but it's a process by which you can circumvent the filibuster. You only need 51 votes rather than 60. But there's certain rules about what kind of a bill can be included in reconciliation. And they can only be bills that have a major impact on the federal budget, fiscal impact. And so some of the things that would have been changed in the conference committee and then gone back couldn't be included in this misnomer reconciliation bill. And so there were some imperfections in the legislation that ultimately were signed into law that would not have been imperfections had we gone through the normal course of things. But the leadership on the House and the Senate had no choice because they couldn't pass a bill over a filibuster. And so we've got some problems. And with respect to the issue you're raising, I will say the legislation was inartfully written. And so is it plausible that those lawsuits can win? Yes, they are plausible. I'm hopeful that they never get to find standing and cases are dismissed. But we'll know soon enough.
Maybe another question or two? Do we have one more? Richard, did you?
In a lot of ways, you're preaching to the choir here, and you said that we need to convince the governor and a number of people in the legislature. And this is, I guess, a question for it's a political strategy question. What leverage do we have at this point, at the rate that the legislature and the governor are going, and they are not responsive to reason?
Well, I'll give you a quick answer, then I think Adam and Rob probably are better positioned to answer it. I'm usually optimistic, and I'm truly optimistic about ultimately what will happen. I'm not optimistic about the governor and the state legislature being turned around on time for January 2014. That seems to be highly unlikely. But one of the things that I think is going to happen around the country is that we're going to see enormous disparities between the healthcare systems in the states that have actively embraced the Affordable Care Act versus those states that have not. And one manifestation of that will be the number of people who are uninsured who gain coverage, and the states that have accepted the Medicaid expansion are going to, obviously do much better in terms of coverage. Right now, the rejection of the Medicaid expansion, the rejection of setting up a marketplace and exchange by the state of North Carolina rather than passing it along to the federal government, it's purely political. It's partisan, it's anti-Obama, it's Obamacare. Anything that's Obamacare, you hold your nose. And I think over time that may dissipate. But there are a couple of things that may happen that hasten that. First of all, when you see the big differences that I think are going to be readily apparent in terms of how the health systems function in states that have embraced the Affordable Care Act compared to those states that haven't, I think there's going to be an enormous difference. And it's, I think, going to be a little difficult for governors to say we made the right thing. But there's one other thing that I think should constantly be stated over and over and over again to this governor and to the state legislature. Why does it make sense that the taxpayers of North Carolina are paying for the expansion of the Medicaid program in California, in New York, in Massachusetts, in Illinois, and yet our taxpayer dollars are not helping people here in North Carolina? And I think that is not going to be an easy thing to say. I would also say, by the way, that you want to take a sympathetic constituency. Let's take a look at veterans who are not getting coverage from the VA, who are uninsured, who could get help. That's a very, I think, popular constituency.
We have a few of those here.
Yeah. So I think there are some political leverage points that exist. Is that going to turn your governor around overnight? Of course not. But I think over time, as you see a much better health system in different states, if people understand that people who you really think should not be excluded from health care, like low-income veterans who are not getting VA coverage, and you feel that your taxpayers are subsidizing folks in other states but not this state, I think those things will accumulate and might change the political equation.
Our Senate Minority Leader likes to say that people aren't going to stand for it. Maybe that'll happen. So, Robin, did you have a question?
They might march.
No? Adam, you were telling me something. Robin.
Did you have a question?
I'm Robin Lane from Greensboro. And I've been to Families USA conferences. I just want to tell you how appreciative we are of the work that you do. It's very important to us. But we had Secretary Voss, who's from Greensboro, come back to our city to tell us about the plans for privatization. And I wondered, is that a big deal? Is that a distraction? Is it something that advocates should really pay attention to? Do you think it's not going to happen?
Well, I can't say whether it will or won't happen. And you need folks inside the state who have more knowledge about this than I do. But why would one want to do this? When you're sensitive about costs and you're privatizing and you're saying this theoretically, let's have competition among private health companies, why do you want more money to be spent on marketing and advertising? Why do you want money to be spent on profits? One of the things that the Affordable Care Act tries to do is it tries to make sure that more of our premium dollars get used for health care as opposed to administrative-related costs, whether it's marketing, advertising, agents' fees, profits, and so on. As you introduce this private sector coverage, I think you're going to have a lot of expenditures that do nothing for your health care, but that are going to add costs. So how do you make up for it? Well, the way you might make up for it is you pay the primary care physicians a whole lot less money, and at least here in North Carolina, you're paying, 95% of Medicare which is better than other states do, you can save a lot of money by making it 65%. But what is that going to do to Medicaid beneficiaries? They'll have the card, but they won't be able to find a doctor. So I would say leave good enough alone. There are some good things that are happening here. Don't change something that is more likely going to make it work.
And I think there's reason to believe that that message is being received actually in North Carolina, and that privatization is not fait accompli by any stretch. So I think there's grounds to keep fighting there and cause for optimism. I think we've reached the end of our session here, and I just want to ask you to join me in thanking Ron and Adam. Ron was able to do a lot of media while he was here, hopefully get his message spread, and we hope you all take it with you and spread it as well. And stay tuned, there's lots more to read on our website, more events to come. Thanks for being here today.
Thank you.